Great. Well, should we start letting people in? What do you think? I am the initiatives manager at Special Olympics Washington. So I work with some of our programs in athlete leadership and family support, which is part of why we're here today. So Robin and Ramona approached me wanting to share this information with our community through Special Olympics. So I'm really excited that everyone is here today to learn a little bit more about some of these budget cut proposals and how we can make a difference there. So I will pass it off to Robin and Ramona. I'll help out with the chat or anything else. Feel free to ask questions. But otherwise, thanks for being here.
Yeah, I'll start. Hi, everyone. My name is Robin Tatsuda. I'm the new executive director of the ARC of King County. And Ramona will introduce herself in a minute and sort of lead the show for a while, but I just wanted to express my gratitude to Leah and for Special Olympics for the opportunity to partner. It's people with developmental disabilities and their families intersect with a lot of different programs, but don't always intersect with all of them. And we've been working really hard to make sure that this information gets as far out into our community as possible. And we're really thankful to get to link up with folks who are engaged with Special Olympics. So thanks for having us. I'm gonna let Ramona take the lead and then I'll fill in gaps. But as Ramona is talking, I'm gonna encourage folks actually to type in the chat if you're able. Tell us sort of who you are. And we're gonna be talking a lot about Developmental Disability Administration or DDA services tonight. And so if you know if the person in your life with a disability has DDA services, such as a waiver, tell us what they've got. My person has an IFS waiver or a core waiver. They're using respite care services or employment supports, and then also how old they are and where they live. I'll type it in the chat. That helps us know who we're talking to and to make sure that we're sort of tailoring what we're saying to really make sure you're understanding how this is going to impact you and the people in your lives with disabilities. Okay, so I'll type kind of what I'm asking for in the chat, and I'll let Ramona take it from here.
Hi guys, my name is Ramona Hattendorf. I am the Director of Advocacy here at the ARC of King County, and we will be sharing this presentation with you guys, and our contact information is on here. Super quickly, advocacy at the ARC of King County. First of all, the ARC does all kinds of programming and resource support and guidance and one-on-one consultation. In the advocacy department, what we do is civic engagement and leadership. That's really, we help people understand what's going on. We help connect them with leaders to show how decisions might affect their lives. We want to make sure that people, to the maximum extent possible, who are using services are actually connecting with the people who are making policy and budget decisions about those services, or who are delivering those services, so they can be better. We're about making things be better. There are people at the staff who are all about navigating services, but we won't be talking about that tonight. Our goal on the advocacy team is really basically really good informed public policy and good investments. And by public policy, I'm talking about both the rules and the laws that the public in general has to abide by, but also public policy has this essence of the public should be informing the policy. So people should be having a say in the services that they use and they rely on. And so that's in general what we try to do at the ARC. And that's what's informing this presentation and other similar presentations that we do. So right now, today, we are going to be talking about cuts, possible cuts. So if you hadn't heard, we are in a mess of budget trouble at the state level. We have a budget gap, sorry about that. We have a budget gap. And what that means is that the state doesn't have enough money to pay for the services that it wants to. And this affects both the current budget that we're in right now. They're expecting a shortfall and they're not sure what to do about it. And then they're also, the state right now is working on the next budget. The state actually creates budgets for 2 years, and the budgets lay out by all the different departments and services what the state thinks it's going to need to spend its money on, and then what kind of revenue it expects to have. And so when you don't have a lot of revenue coming in, you have to do fewer supports. And taxes pay for it all. They pay for schools, healthcare, housing, food, and disability supports. And a lot of people, if you have a disability support, you're probably getting, sorry about that, you're probably getting some sort of long-term support, and it's probably through Medicaid. It might be through the Developmental Disabilities Administration. It might be through Aging and Long-Term Supports Administration. You might be getting personal care through what's called the Community First Choice program. But all of those fall under the awning of Medicaid. And those are looking at possibly some cuts. So what happened is we faced this in two scenarios. With the current budget, they're trying to figure out what, if they have to cut, what to cut. And so the governor asked the different agencies to do an exercise where if they had to find money to save, where would they find it? And they came up with some different proposals, and they worried us quite a bit. But then they ultimately didn't act on any of those. They're waiting to see if enough money comes in, how much they actually have to cut. But then in the meantime, I'm sorry, my computer keeps going forward as I'm moving my arms. In the meantime, while they're working on the next budget, they asked all the agencies to prepare what they think they need to run, but to also identify 15% in savings. So they asked each one, if you had to spend 15% less money on your programs, how would you do that? And for the Developmental Disabilities Administration, which I'm going to be for short, I'm going to call it DDA, that means about 601 million. And for Aging Long-Term Support Administration, which I'm just probably might just refer to as ALTA, that's more than $1 billion. So we're talking kind of a lot of money here. And here is how they did it. So through the Developmental Disabilities Administration, they identified some different savings, but as you can see, by far the biggest one is this one down here. And it is just under $500 million. So it's a lot of money. And it's about what they're calling, they're going to change the eligibility. So a lot fewer people would be eligible for the DDA supports that they currently get. And these are supports, if you get a job coach or employment support, that would fall on here. If you get residential support, that would fall on here. If you're a family, there are some adults on it, but mostly it's youth and children on the family, individual and family services waiver. If you get respite, you probably fall on here. If you get personal care, you probably fall on here. So it affects a lot of people. Furlough is, that's state employees are taking 1 day off a week, not unpaid. So you get some savings like that, some attrition savings. RHC stands for Residential Habilitation Center, and those are large institutional places of care in our state. And so they're talking about closing one of those and consolidating. There are several, they're going to close one. They're thinking about consolidating. Provider rate cuts, that means people who actually provide the services would be paid less by the state. And there's concern about that might make it the workforce very unstable. And plus, is it really fair? But these were the kinds of cuts. But by far the biggest one was the idea that we would just make fewer people eligible for DDA. And that means people who are currently getting services would lose their services. And it means yeah.
Sorry, just so you know, several of the people have written in here that their loved one has a basic plus waiver. And
Okay,
a lot
yeah.
of folks who have written say their loved one is getting support employment services.
Okay, thank you. Yeah. So 30% of the DDA clients who are supported in the community would lose all their support if the proposed plan went through. 30%. Overall, it's a little bit less. Overall, it's about a quarter, but that includes people who are getting supported in large institutions. But if you just look at the people who are getting support in the community, it's 30%. So that's about 1 in 3. So when we first started trying to ring the bell and let people know about cuts, I think we felt a lot of people thought it probably won't apply to me. And then as we finally got the numbers and then we compared them to the DDA caseloads, realized, well, it really might. It might affect you. 1 in 3 is a lot. So again, so the employment, if you get employment support, is definitely going to affect you. Here's what they were doing in ALSA, very similar approach, very similar cut proposal. Both DDA and ALSA, by the way, are part of Department of Social and Health Services. So it kind of makes sense that they followed the same approach. They followed very similar cuts, but the biggest one was client eligibility changes. And a lot of people with developmental disabilities actually are supported in ALSA. If you're in an adult family home, those are operated through ALSA. And a lot of people don't necessarily qualify for DDA supports, but they do qualify for aging long-term support. So a lot of people who perhaps with cerebral palsy might be served in ALSA and not by DDA. So there are a lot of people in our community who get support through ALSA. So as I'm sure you guys know, especially if you're getting employment support, this is not just a service. This is your life. It's your life they're talking about. And these cuts really alarm us. I mean, all of the cuts proposed are concerning, but the cuts, the change to eligibility, that really, really worries us because the people could lose the support they need to really live and thrive in the community. We titled this one, this particular class, like a threat to inclusion, because if you're not supported to live in the community, then a lot of people fall into they become increasingly isolated, and they're not really participating in their community. And that affects them, affects your health, affects your well-being, affects the family who's living with them and supporting with them. So these are very, very worrisome. And as I mentioned earlier, it can mean losing your job. Mobility for people who lose their access to personal care can mean losing their ability, and perhaps they might end up being unnecessarily hospitalized if they're not getting the care that they need. Some of these supports are directly tied to where people live in the sense of an adult family home. So if someone supported by ALSA, if they lose their eligibility and their placement in an adult family home, they're literally just being made homeless. There's actually 50 people who are in a residential rehabilitation center who would lose eligibility under the plan. They would lose their home that they know. They might have family that they can move back in with, but they might not. We don't know. So these are really serious cuts. And they, as I mentioned earlier, they can affect their health. They can also cause an economic crisis, especially for the family as a family unit. We know that community supports our lifeline. And a lot of people then follow up, well, who exactly is going to be cut? And on that one, we're going to go share some slides that DDA, they modeled the numbers. I can tell you that they go pretty high. It's not just people with light support needs. People with some pretty significant support needs are looking at cuts. But it's not really clear exactly why one person at a certain assessment level would keep their support and another wouldn't. DDA said it was very complicated. They couldn't really say. So we're not sure at this point. And we're not sure if it's going to become more clear. We're hoping that it will, but right now they really can't tell us. They did share that they tried to look at some sub-factors and tried to protect some that they thought made some people a little bit more vulnerable, I guess is how you could look at it, than others. In some cases, to get to a certain assessment level, they might look at maybe the 2 activities of daily living that needed support with, and then now they're going to be looking at 3, some things like that. And also just wanted to flag that some DDA clients, we do know there are about 305 DDA clients who are supported in adult family homes, so they would lose their support. And here's where the numbers of this fall out to. The core waiver, you can see on this, a little under 2,900 on the basic plus waiver would lose their eligibility. So those of you I think a lot identified, you knew already you're on basic plus. If you're getting employment support, you're probably either on basic plus or you're on the core waiver. And so a lot coming from there. But I also just want to flag out, just so you guys know, there's some people who only get community first choice, they only get personal care. Half the people who only get personal care would lose it. So that's another big one. And so what do these numbers look like? You're going to put them out on a pie chart. Here's what it would look like. This is plotting out who was actually affected and would be affected, who would be cut if, as proposed, the eligibility changes were made. and 35% come from Basic Plus waivers. So the majority of people aren't necessarily from Basic Plus, but the largest individual subgroup is Basic Plus, and about 35% of the spots that would be coming up Basic Plus. CFC stands for Community First Choice on this graphic, and IFS stands for Individual and Family Services. And then another way of looking at this is how does the dollar impact? When they look at it dollar-wise, most of the savings, a little bit more than half, are from supported living, which most people will access through the core waiver. And supported living is a residential program where the program doesn't provide the place that you live in, but they provide the staffing to help you live there and help maintain independence. And that can really vary from very sort of light touch to really intensive 24/7. It really depends on the needs of the individual.
Ramona, at least one person in the group has said that they have a core waiver and are using supported living services.
Yeah.
So it's
Yeah.
important for that person to know that nearly a quarter of people across the state who use supported living services are projected to lose their waiver, which means they would lose all of their supported living services and potentially, depending on the agency that you use, potentially where they live as well. So it's very, very concerning.
Yeah.
That's-
Yeah. And I think what's something else we're really trying to make sure people understand is they're not talking about, well, we'll just cut back employment or we'll just cut back on respite. They're talking about changing eligibility, which means that you would go from getting to nothing. You wouldn't be eligible for any supports. You would be off the waiver. You would not be eligible for support anymore. So that's something that we really wanted to emphasize. Another way of looking at the cuts is comparison to the total caseload. And again, on this one, what's looking at by type of waiver through DDA. CFC again stands for Community First Choice, and that's personal care only. And then RHC stands for Residential Habilitation Center. If there are a few who would lose, I think it was 50, who actually, if they changed eligibility, they would no longer have the Residential Habilitation Center placement, and they wouldn't have any other placement either. So sometimes when people want to leave a residential setting, resident habilitation setting, there's different programs to help them transition into the community. Under this eligibility plan, I don't really see how that would happen because it wouldn't be eligible at all anymore. Community First Choice, again, that's personal care. I think a lot of the people here tonight are on the Basic Plus. And as you can see, the Basic Plus is by far, that's the biggest waiver that we have. The IFS one is the newest one. They used to be a state-only program, and now about 5 years ago, somewhat recently, not quite 10 years ago, but more than 5, they changed that to a federal program so they could get the Medicaid federal money match. And so a lot of the roles, like in the last few years, they added 6,000 people through the IFS creation waiver. We've been slowly adding people onto the Basic Plus. About every year, we've convinced the state legislature to open up 100 to 200 to 300 additional slots on Basic Plus so they could take in the kids who are transitioning out of transition service in K-12 and into post K-12 life. All of that gain would be lost. And again, these are not just temporary cuts. This is permanently changing the eligibility. So this would affect people who now maybe don't have a Basic Plus, but they were thinking that, oh, I'll be eligible for that. I'll be able to get that, and I'll be able to get those job supports in a year or two, and it would affect them. So about a quarter of all clients, and about a 30 of people using community supports would be affected. And I think at this point, you guys, it sounds like this is a crew who's familiar with the waivers. Sometimes people are like, what is a waiver? And it's a long-term support that's administered through Developmental Disability Association, funded by Medicaid. Some of them go through DDA, some of them go through ALTSA. They're called home and community-based waivers. You might hear that expression also. This slide, I just did a graph. I went on there, a lot of waivers. They have a menu of services. This one was grabbed from individual and family services. So you can see there's a lot of different options that you can use. And that's sort of like an entry level waiver, if you want to say. And then the basic plus is where they have a similar menu, and then they add employment support. And then the one above that is core. Again, you have similar, you have they call it an aggregate of menu options. And then they also offer employment, and they offer residential. And then there's a few other waivers that are very targeted for very specific populations. And then another question a lot of people have is like, how would I know if this affects me? And this is a sample of someone we know. They gave us permission to share it. And then this one, you can see this particular person they go through assessment. And if you guys have gone to your annual assessments, their score was A low. And you can see that in a classification group, A low. So that's how this person was assessed. And this is a person that currently is a DDA client and does get supports. And as you can see on here, though, when they did some modeling, they didn't model, by the way, on employment. So I don't know how deep they go into employment. This was a document that was shared out with us, and we have the links. You guys can go in and check it out yourself. They did share for personal care, and they shared for residential care. And from this, we can see that people as high, E is your highest, people even as high as E high and E medium would lose supports. So they're going pretty deep to find these savings. A lot of people, in the B medium and B medium high, but they go pretty deep. They go well into the E range. And as I kind of mentioned earlier, it's somewhat arbitrary as well. We don't know why, because certainly there's probably more than 54 people who are assessed at E high. So we're not really sure why these individuals at EI would lose all their support and others might keep them. We're not sure what those subfactors are or how the algorithm worked where they just had enough. It might not be it was one subfactor. It might be they were assessed a little higher or lower on several subfactors. And that's what put them on one side or the other side. We did try, and DDA would just sort of say it's not that simple. They couldn't give a simple direct. What they did say is that they kept having to go deeper and deeper to get to the required savings. And then when the state cuts 15%, because there's a federal match, it means actually 30% of the funds are being lost because you lose your federal match. You only get the federal money to the extent that you offer the state money. And then we also have, this was another modeling. This one was looking at supported living. And on this one, there's an assessment level that goes up to 6. And even there, they got pretty high. So this doesn't tell us exactly, like, it won't inform you whether you or your loved one or someone in your family or someone you don't care about would lose their support. But this does tell us that people with some very significant support needs are affected, and that it's not just people who only need a little bit of support. We know there are people who need a great deal of support would be affected. And then if you're curious about the DDA caseload, they have to post it every year. And they posted it a couple of weeks ago. And there's a link here, and that actually can tell you, I mean, not everyone is really into the data, but if you're ever curious, I went ahead and I added this link here, and you can go in and it'll tell you just how many people are in supported living, how many people are getting different services. There's a lot of information in there about DDA if you were curious about it. And then for ALTSA, the rationale there with fueling a lot of their decisions is they eliminated one program called medical personal care and got rid of it. And then for most people, what they did is they added what they're called activities for daily living requirement, where before you might only need support in 3 activities for daily living. Now you might need support in 4 activities of daily living. And by doing this, 12,000 people would be cut from their roles. And all we're talking about between ALTSA and DDA, we're talking about 20,000 people who require supports, who would lose their supports. And then with ALTSA, something was also very concerning to us is that they said that most of the people who would be affected are people who need some sort of support for cognitive support. Like that would include people with developmental disabilities, behavioral health, traumatic brain injury, early diagnosis of dementia. So there's a lot of concern there that if they're not being supported by ALTSA and they already didn't qualify for DDA, are there other components of our safety net who could help them? And I won't go into this one, but it's very similar. Also went down and they did a breakout like DDA where they could show most like DDA, it affected people who got supported in the community a little bit more than people who are being cared for in facilities. Same thing with ALTSA is that not all, but the majority are getting in-home support. Some of these initials, AFH, that's adult family home. And this was another one from ALTSA. And again, on this one, you can see theirs don't seem to go quite as high as DDA's does. But yeah, you get people with some significant support needs. And I'm going to pause here because Robin hasn't had an opportunity to say anything. And I'm sure she would like to share. I want to say that what you just went through was a proposal. And this is something that always happens every year. The state has a budget process and they start by the governor asking the different agencies to come up with a draft budget. Like, what do you need funded? What is the caseload? If there's a policy change you want, how much would that cost? And so that's what all this was done. Is they call these decision packages. And so and there's a place online where you could go in and you could find them. All of the different agencies submitted their decision packages. And now the governor's staff is going through all these and they're going to compile a budget. It's a budget proposal. The governor doesn't actually write the budget. The governor comes up with a proposal. The state legislature will write and adopt the budget. The governor can then veto parts or all of that budget, but the actual budget writers are the state legislator. But the governor does have to submit a budget proposal to the state legislator, and he will do that. Usually it comes out mid to late December, early January at the latest. The state legislature session will start in mid-January, early to mid-January. I think it's 10th or 11th, somewhere in there. They start, and they will be going in through April. So we won't actually know for sure if these cuts or other kinds of cuts go through probably until April or May, maybe even June. But we do know that we have to start acting now, because if the governor agrees that they should be cut, then that's a really indication to the state legislator that this is a good area to cut. So that's why we don't want to wait until April or March or February or even January. Now is important to understand, and now is important to reach out to legislators. And now I'll be quiet for Robin.
Thanks, Ramona. So you all know Ramona will start talking to you about ways that you can advocate and sort of engage in this conversation. So we'll get to that, don't worry. But I just kind of want to reinforce what Ramona said, say it again in a different way. So as Ramona said, DDA is saying they're going to change the eligibility rules. So people who right now are eligible for services and receiving services are going to be cut from those services because they're going to change that eligibility. And there is no guarantee that it will ever go back to the way it was. That's what we're especially worried about. It's one thing to change the eligibility temporarily, which would be hard for many folks, but maybe not the end of the world. But there's absolutely zero guarantee that this change would ever be reinstated. And if it was, how long it would take. So the cuts they're talking about now are much deeper and severe than those that were made 10 years ago during the recession. And it was only around this year or last year that we finally caught up to the cuts that were made 10 years ago. So if you can imagine that these cuts are worse, then you can imagine that it might take well more than 10 years to potentially make up for it. So that's another reason why we're so alarmed. It's not a temporary pause on services, it is a complete removal of services for a lot of people. And so if you're getting anything from DDA, the majority chance is that it's because you have a waiver from DDA. A lot of folks know they have a waiver, but not everyone knows that. But chances are you have a waiver. And a waiver is, like Ramona said, it's sort of a menu of services. I like to call it the combo meal. You get a combination of services with a waiver. And when you lose a waiver, you lose all those services. You don't just lose one. You don't just have it reduced a little bit. You lose it all. And so that's also why this is very concerning. It's not just that you'll lose a little bit of respite hours or a little bit of employment hours. You could lose all of it. Additionally, as Ramona said, we're really worried for anybody who's living in an adult family home, in a supported living program, or any other kind of residential service, because not only could they lose their supports and their care, but they might also lose their house. And that would just be horrific. I think we all can agree that that would be horrific for our community. So these just to reinstate and reinforce, like this is terrifying. This is very scary. It's very, very serious. And no final decisions have been made yet. However, the state has told DDA to move forward with the process that they have to go through to make these cuts. They actually have to get approval from the federal Center for Medicaid and Medicare in order to make these changes. And so they're starting that process of getting approval right now. So again, the final decision hasn't been made, but it's moving forward, which scares us. So Ramona's going to talk a lot about what we can do about it and how to take action. And that's really my next point, is that the developmental disability community is a small community compared to the total population of people. But we also are a mighty community, right? The whole reason supports exist in the first place is because the community demanded them and the community advocated for them. And so we know we have a history of really shaping a system and ensuring that things are there for our families and our loved ones. And so I really hope that we can do this again. This is the time that we need that, everybody's help to do this big push to protect services and even build things out further. So I guess with that, Ramona, I can maybe you want to take it back and start talking about action.
All right. So a lot of times, and we've started talking a little bit to legislators, just so you know, because some people want to know. And the various groups came together and helped do some, they called them Advocacy Day for the summer, but they were forums, but they were targeting the budget writers, really. So mainly legislators who would write the budget. And we had 6 of those over the summer, and they were good. And so some of the budget writers have been educated on this, but not all the budget writers, and not the local legislators. Robert and I, we happen to live in the same legislative district, which also happens to be the legislative district that the ARC is housed in. And we met with 2 of our legislators, and I think one of them seemed to be familiar. I think both of them were familiar that cuts might be on there, but they didn't really know the details. So do not assume your legislator knows the details, because unless they're on the budget writing committee or unless they're on the lead policy committee, chances are they don't know, and they certainly don't then have a gauge for how big these cuts are or how much impact they would have on people's lives. So then a lot of questions are, well, what are the options here? And a lot of times, not so much now, but over the summer, people say, is there federal stimulus money? And the state did get some federal stimulus money, but it was really for very targeted things. Some of it went to the schools for targeted. Some went to DDA providers for things like personal protective equipment. So there was some money that we released, but it was for very specific things. So it wasn't something that the state could use to sort of backfill for funding Medicaid long-term supports. So the stimulus money that came in over the summer isn't really an option. There is money that the state sets aside, they call it the rainy day fund for emergencies. And they are looking at tapping into that so they don't have to make such deep cuts for the current budget. Again, the state is looking at, do they have enough money for the current budget? Do we have to make cuts now or the next couple months? And then they're also looking at what can we afford to budget for over the next 2 years. And so it doesn't seem like there is enough money for the emergency fund to take care of the now budget. And then if they used it all for the now budget, there wouldn't be anything for future emergencies. So the emergency fund will be in play. They'll definitely be tapping that, but that's not going to solve the problem either. And then we also, some people say, well, can the federal government just give us more money for Medicaid in general? And naturally, actually, advocates have been asking Congress to fund more what are called home and community-based services. Again, this is what the waiver programs are. They're called a home and community-based service waiver. And so that's certainly an option, but so far Congress has not increased those funds. They didn't do it in any of the CARES Act that they passed. And there was talks over the last several months, but nothing came up. And now it looks like they may not come back together again until early January. You kind of have a lame duck session. We don't know what's going to happen with the presidency yet, or unless it was announced since the meeting started, we don't know that. So we really don't know when or if they'll come back. And then also, this is really important that even if the federal government said, we're going to throw all kinds of money into these types of supports, and historically they have not, so that's unlikely. But even if they said, we're going to throw all kinds of money, Washington would only get it to the extent that they're putting in their own match. So if Washington made these cuts and the federal government put money in, they wouldn't see any of that federal money because they've made the cuts, because they only get the federal money, it's a match. So if they increase 10%, then they would get more federal money. If they cut 10%, then they lose the federal money. So even if the federal government comes through, it may not help the state if the state wants to cut into Medicaid programs. And so, so then people think, well, okay, so if we protected eligibility, what were some of the other cuts at play? And we mentioned those briefly before, but they're talking about cuts to provider rates. It wasn't long. I don't know if you remember the bar, but the bar for eligibility for this long and the provider rates bar was for this long. So this wouldn't solve the problem either. We also have concerning because it would destabilize the workforce. There's talk about closing a residential rehabilitation center. Interestingly, in the short term, it would be actually more expensive, but in a couple of years, it would save money. We won't go into detail. We haven't really prepared anything around that, but I would also say that back in that one thing where we had all the little short bars and the long bar, even something like this was a short bar. So that's not going to fix the budget problem either. And there's a lot of considerations that go along with making a decision about when or how or if you scale back the residential rehabilitation centers. That's not really typically something you do in a matter of months. It's something that requires a lot of planning and a lot of care. There's other cuts, there's staffing cuts, and those cuts are being placed now. And so the state is, they're being fiscally responsible. They're saving money as they can now. But again, that was this big of a bar. It wasn't the big, long bar. So concern there. And then even everyone had to go through these 15% cuts. So there are other agencies too that are looking at cuts too. And some of the one for Medicaid, a lot of like your regular Medicaid through Apple Health. Most of that is protected, but there are some services that aren't. They're optional for the states, and those would include adult dental, some interpretation services, some of your therapies for adults, your hospice. The list is there. So there's some optional Medicaid programs that the state could cut, and that would affect the people who rely on them quite a bit. And so we're kind of back to where we are. It's like, what do we do if we really rely on the safety net? A lot of advocates, we're not here tonight to tell you what to say, but we are very willing to share what we're concerned about. And we're really concerned that the safety net, not only when you cut holes in it, the whole part of a safety net is to catch people. And these long-term supports, these are the safety net for people with developmental disabilities. So they're talking about cutting a huge hole and people falling through the safety net. But also the supports, these long-term supports, they build connections and they build resiliency. They help people live and participate and be part of the community. And they're really critical for everyone. So in our advocacy, we're saying you can't go there. You can't change eligibility. We got to figure out what to do, but you can't just change eligibility on a mass scale like that and cut people off. It's just not somewhere that we think we should go. And as I said earlier, there's no decisions yet, but we're worried. And so what we're doing, we'll come back to questions, but basically right now is we're asking people to contact the legislators. There's two things that you can do right now. It'd be really easy. Contact your legislators. And if you know of somebody else, let them know that maybe this is something they need to learn about because it could affect them. It could affect a loved one, it could affect the community. It's going to be important. So we're asking people minimum, find out who your legislator are. And I have a link here that can help you figure out who your legislators are. But you want to contact them. And we're actually asking people to plan on contacting them 4 times. Now, when the governor releases his budget, which will be sometime between mid-December and January, midway through the legislative session to remind people that this is really important. And then towards the end, when the budget negotiations are really heating up. This is not a time to assume that somebody else is speaking for you. This is not a time to assume that, oh my gosh, I don't want to bug my legislator. They're elected into office to be bugged. They have legislative assistants that are paid to be bugged. So go ahead and write them and go ahead and call them. That's how our public policy system is set up. It is set up so people can contact their leaders and people can let them know. So contact them now. And there's a form, there's a link. I have my thing on here. There's a link here. And just so you know, Leah she's going to be sharing the PowerPoint, and she's also going to be sharing that all these links will be in the PowerPoint, but she also said that she would pull out key ones. So she's going to pull out these links, but this is a really good one. So if you were to click on this link, it would take you to the state legislative website. It would take you to this page here, and you type in your information and your legislative districts pop up with some names. And if you click on their name, then you get their contact information. There's a little picture, shows you who they are. You find out what their email is, what their phone number is. It's a district office phone number. It's not a personal phone number, and it's not a personal email. And just so you know, legislative, that means state. Congressional, that's federal. So if you're to hit congressional, you would get your U.S. congressional, U.S. congressman or woman, or you get one of either Patty Murray or Maria Cantwell, our senators. This particular issue is a state issue. So for this one, you want to contact your state legislators because the federal legislators can't do anything about the state budget. It's got to be your state legislator. So the minimum thing is to go to this website, find out who your legislators are, send them a note, and let them know. I would really just encourage you to share how these cuts would impact your life. We have a tool that we created for you. Some of those slides I used. It's this is really something it kind of gets into the weeds. So it would be good for the legislators and their staff But it's here for you. But I also included some talking points on there. So this is a tool that you guys can use for yourself to read through. It's also something that you can share with your legislators. You can contact the governor. If you like to do action alerts, not everybody likes to do action alerts. They want to write their own personal letter. But if you like to do action alerts, that's a really easy way to engage. And you can sign up for the Arc of Washington. They have action alerts. And there's a link here. They did put an online petition together for the governor. And a little less than 2,000 have already signed that petition. But there's also one right now that's it does an email to state legislators, and I want to say only 300 or 400 people have acted on that one. So the state that they might be communicating with their legislators privately though. So it doesn't necessarily mean they aren't. But right now it looks like a lot of people are willing to sign the petition to the governor, but they haven't been contacting their state legislators perhaps. And it's really important that you contact your state legislators. And also some issue that I'm increasingly trying to get people to think about is that long-term care, it's medical care. And it's so if you have legislators who are right now saying, well, we're not going to cut Medicaid, but long-term care is always funded a little differently than regular Medicaid. And not everybody considers long-term care part of Medicaid, particularly DDA. It just doesn't dawn on them that it's part of Medicaid. So if your legislator says, oh, we don't want to cut Medicaid, make sure, does that include long-term supports through DDA? You know, that type of support, that's also part of our Medicare. That's also part of our health and well-being. And also that if people were to lose these supports, some of them could be homeless. Some of them could end up in the hospital if they're not getting their personal care needs, their medical personal care needs met. But also social isolation has serious consequences for people's health and well-being. And so if you get rid of the supports that really help them be in and part of their community, that can really affect somebody's health. That can have a long-term consequence. So that's something else that you might want to consider. And I have a link to this tool. It's a really basic tool for messaging. If you just follow it, it'll give you the basic. You can use this guideline if you want to ever do testimony. You can do this guideline if you want to write a letter. Perhaps you've heard the phrase elevator speech. That's if you like run into somebody and you only have like a minute to talk to them. And it's basically just answering different questions like, who are you? What is it that you're caring about? What is your issue? Why do you care about it? Why should this person care about it? And what do you want them to do about it? And that's really important. A lot of people will share, I'm so worried. This hurts. I don't know what I'm going to do. And that's important. But with your legislators, you need to know specifically what you want them to do about it. And in this case, that will probably vary depending on, remember when you asked 4 times, depending on which one. Like right now, my particular ask, my personal ask was, I want you to know about this, and I want you to help educate other legislators about this. I want you to speak about this in the caucus. I want other legislators to know that you care about this personally and that it's really important to our community. And I'm doing that because right now I want maximum people to know about this and maximum people to care about this. Once we get the governor's budget, my ask will be a little bit different because I'll know whether he went there or he didn't go there or he kind of went there. And I'll have to figure out what my ask is based on that. And as we get closer to the budget, you know, my ask will be a little bit different. But we have this guideline and it walks you through things to consider if you're writing a message. And we also, on this slide presentation, we have some talking points. But right now, I'm going to stop because way back then, there was a slide that had questions. And Robin and I have been talking for quite a long time now. So does anyone have any questions?
And I would encourage folks to just speak up. It's hard to see everybody, and if you're raising your hand, so just unmute yourself and call out.
Hi, I'm Kathy Zimmer. I really appreciate this because I was not unaware. I'm a parent provider of a 37-year-old son with Down syndrome, and our big piece, and has always been huge, is employment support, and his job coaches. I mean, that's a big deal for us and for our family because he couldn't work, and he is currently furloughed right now since March because he works at our little Port Orchard urgent care. And so it's not a safe place for him to be working right now, but he so loves work and it's so wonderful for him. But so this to lose his employment support to access his job would be huge. So I so appreciate this presentation. Thank you.
Yeah.
And I would also make sure you let your legislators know how and why those employment supports are so important to your, I think you said son, to your son.
Yes.
Because sometimes they don't necessarily know that, especially if they're thinking, well, do they need that to live? Like they're, I mean, when they're really big cuts, they're thinking in terms of like maybe healthcare, like is this like life support? So you might have to educate them a little bit as to why this is so important and how this then would affect then their health. Because if you're looking at the difference between being isolated, I'm going to guess it would really affect sort of your mental health and well-being and your skill set. I mean, if you're not out in the community, we forget how to talk to each other. There's a lot of, and that's more serious than I just made it out to be there, but make sure they know that, especially around employment supports, because some legislators have heard it and they get it, and some don't necessarily. So make sure the passion that you just shared with us, make sure that gets conveyed because that's going to be important. And also when you write, if you wanted to write a joint letter would be great. Sharing a photo is great. Anything that helps them to see this is not a budget number. Like the resource that I shared, that's gonna, like, especially for the budget writers, like how big of a situation, like they're gonna be number people and that's gonna help them. But what you want is a commitment from your legislator, and the more personal you can make it, and the more you make sure that they say, oh, that's Bob and Susie. I care about Bob and Susie.
Yeah.
Okay. That's going to be important.
Great. Good to know. I'm happy to do that. Yeah.
Right.
Thank you.
So I've got kind of maybe a basic question, but I just want to make sure I'm understanding. When you say long-term supports, what does that all encompass?
Okay, so these are Medicaid long-term supports. So these are the ones that are provided through aging and long-term care, and they're also provided through the Developmental Disability Administration. The ones through aging and long-term care, there's an assessment that says, like, are you eligible for a nursing home level of care support? And the ones for DDA they use that one, and then they also use one for intermediate care facility. So whether you would need to, in other words, if you need an institutional level of care,
Oh, okay.
that's what these assessments are for. So these are very specific supports that you qualify for through ALTSA or DDA.
Okay.
Well, and I'll simplify that answer and say all DDA waivers are considered long-term supports.
Yeah.
Okay. And all, like if your loved one lives in an adult family home, that's considered a long-term support.
Personal care.
If they have personal care, if they have a job coach, if you're getting respite care, essentially, like there's almost everything. There's always a little like caveat, but almost everything from DDA is under the umbrella of a long-term support.
Okay.
Okay.
He would keep his, SSDI or SSI, right? But
That's
everything
separate.
else,
Yeah.
but everything else would be gone.
Yeah. Yeah, that's a good point. It's not necessarily all benefits. So it's not necessarily your Social Security benefits, but it would be your Medicaid benefits.
So you might not know this, but all the waivers and all the supports through ALTSA and DDA are funded through Medicaid. And again, most people don't know that. Most legislators don't know that. But they're funded through Medicaid, and they're called Medicaid long-term supports. But we tend to know them more like waivers or by the name, like respite care or employment supports or whatever. But that if you track the money backwards to know where it came from, It came from Medicaid long-term supports.
And what is federal? So we get a match for, do we get a match for all the Medicaid?
Yeah,
Mhm.
and depending on what it is, the match level varies. It
Okay,
varies by state, because sometimes it's like how the amount of poverty in the state can influence that, and it also can vary on the type of service. I want to say Community First Choice, they got a really good match, which is one of the reasons why they expanded that program, or created that program, I should say. But generally, it's around 50%, like ballpark, but that can vary.
that's helpful. Thank you.
Mhm.
Any other questions?
If there isn't a question, I'm going to nerd out and go into a small weed. take this for what it is. But most people don't know how DDA is funded. And first of all, I just want to say, and this is referring to the 31st and following, this is a talking point. Right now, we're 41st in the state for investment in community support. So these type of long-term supports that you qualify for, mostly through DDA, we're 41st in the nation. So we don't invest a lot. We actually invest pretty well in Medicaid. We're a really good investment in Medicaid in terms of like Apple Health, and that's your general preventative type of healthcare. And even we're actually pretty decent in the ALTA side for aging and long term, and those also cover more physical type of disability. We're pretty decent there, but we're really low when it comes to developmental disability specific support. So if you didn't know that, we have highest caseload, case manager to client ratios in the nation of 1 to 75. And this is where I'm going to nerd out, is that a lot of people, that we have all these people who are eligible. Like, we know that not everyone who is eligible gets support. So right now there's about 14,000 people who are sitting on something that's called a no paid services. And some of them want support and they're waiting. And some of them might just be there. They're not sure when they're going to want support yet, but we think most of them probably want support, or they wouldn't have bothered to apply for DDA. So we know we have about this 14,000. We know at the federal level, usually what they gauge is about 1.5% to 2% of your population is ballpark, meets the federal definition for developmental disability. And we know that in our state of this, that would be like about 120,000 people. And this is a very high bar to qualify for developmental disability. But this 1.58%, there's about 120,000, but the state's only serving maybe a quarter of those people. So we already know that like tens of thousands of people are not served. But what people don't realize is that the state doesn't budget by how many people are eligible for services. The state doesn't budget by how many people who are likely going to be eligible for services. The state doesn't budget by who needs what kind of service and how much those services are going to cost. The state budgets by who is already in the pool. So there's a very small number in the pool. There's about 45, maybe it's 49. There's somewhere in the 40s of DDA clients. But once you shrink it down to who's actually getting a waiver, it's only about 20,000 people. And so the state funds for only those 20,000 slots. The state doesn't fund for the other 14 to how many, 20, 30,000 who would like to have and who could qualify for one of those slots. They're only funding for the people who are in the system. And if the people in the system aren't using all their supports, like say they couldn't find a respite provider and they left money on the table, then the state takes that money out because they say, we don't need to invest that much money, and they take it out. So that's something important to know, is that the state doesn't have a mechanism that attaches the need and the eligibility in the community to how they're funding. And this is another reason why we're always in such a bad spot.
I'll add to that, Ramona, that I'm not implying in any way that this group is any older than 29, but I know there's a lot of families out there where the parents, the person with disability still lives with their parents. Their parents are perhaps in their 50s, 60s, 70s, 80s, who knows? And the person with disability probably wants to live out on their own or in some other type of setting. Maybe the parents are thinking about when they can no longer provide care. DDA has no plan for that. They have no plan for what would happen when those parents aren't going to be able to be that caregiver. And as Ramona said, they're not even budgeting for it. If you've asked for services and haven't gotten them, so maybe you've asked for supported living services or you've asked for more respite care and they've turned you down because they don't have it available. They didn't add that to the budget for next year to say, oh, this family needs supported living, so we need to make sure we put more money into supported living. They didn't do that. So that's another big flaw with the system. They're not planning ahead for what I call the silver tsunamis. All, you know, the baby boomers who are getting into their silver tsunami years, and they're not planning for those baby boomers' kids, and that's also very, very concerning.
But I echo everything Robin just said, but she was saying DDA doesn't plan. I'm going to be the bad person on the state legislature. They're not planning also. And so your legislator may not be planning. Maybe your legislator is. So there's a few of them that are like awesome. But yeah, the state's not planning. They're not looking at needs. So I just wanted to like, I'm sorry, I don't like to go too much into the weeds with people because it gets confusing after a while. But it's important to know that a lot of legislators don't even realize that they're not funding DDA because they don't even know how it's funded. And they sort of assume, because other things like with Medicaid, the regular Medicaid, they get caseload forecasts. It's like, hey, we know we have this many people in the caseload. We got this many people becoming eligible. They fund for that. For prisons, we got this many people in the prisons, and we know based on projections that we're probably going to get this many more people. They fund for that. Schools, they fund for that. They fund for that. They have caseload projections. They do not, they could, but they've chosen not to. And I say chose because we keep asking them to, and they keep saying no. So this is a decision that our state legislature has made that they will not do caseload forecasting. They're kind of now, they finally budged a little bit and they said, well, we'll do a courtesy caseload forecasting for the IFS waiver and the basic plus waiver. But really what that does is essentially they're going to survey the unpaid people on that no paid services list. They're going to survey them and say how many people actually want services that are IFS or basic plus. So that's what they finally are going to do. And this is after years of advocacy. So ask your state legislators why they aren't funding DD and why they aren't funding for what the eligibility requirements are. These are people who need significant support in our community. No, and they're not factoring that into their budget scenario. And then, and I mentioned this before, the federal match. So when you're talking about 15%, it's 30%. That's something that some legislators, it really rings their bell because I realize that it's like twice as big of a cut. So I would go there. And that's often the reason why you'll say, well, we can't go into Medicaid because, you know, we'll lose half of our cuts to Medicaid. It's twice as deep. And it's like, I'm so glad that you said that because DDA supports, who knew, they're also Medicaid. So if there are a legislator who wants to protect Medicaid, make sure they know, well, DD is Medicaid. Do I have your commitment to protect DD as well? Also, the state's got a whole committee now. They're working on poverty. And they did this study and they listed like the different poverty rates of different groups. And I'm sure it's no surprise to those of you who are on SSI, have a loved one on supplemental security income, that people with cognitive and behavioral disabilities are in the deepest poverty. Because if you are qualifying and living on SSI, you're living on like what, $10,000 a year? So, but this is often something that other people don't always make that connection, that we're talking about people who without support, like if you had somebody who was on DDA, also got SSI, but they lost all their DDA supports, it's not like they can go buy these privately, you know, there's not a lot there. And so this is a community that it can be in very, very deep poverty if they don't have a family support structure around them. And even if they have a family support structure, what happens then is their family then takes the economic hit. So that's something else that sometimes to help people understand that when you're making cuts to an individual, you're actually making cuts and adding a lot of stress to the family that surrounds that individual. And that can cause a lot of instability in the community as well. It's never just one person. It always affects a wider number of people around that person who love and care for that person.
I wanted to add something, Ramona, if I can, to kind of go backwards. Um, Earlier, Ramona was talking about sort of the classification groups. Ramona, are you able to go back to that slide
Yeah.
that showed the like assessment thing? So I want to say a few things about this when Ramona gets there.
This one, or do you want the actual
One
chart?
before, I think that one. Yeah.
This one? Yeah.
So you should be able to find this same little graphic on your planned action notice that you get from DDA, and also in your like assessment sort of summary afterwards. And so you should be able to go in and see like what sort of classification group your loved one or yourself is at. Most people who we've been talking to have assumed that their person is probably a pretty high classification group. So the highest you could get is an E high. Okay. The lowest you could be is an A low. And I'm going to give you an example. The person right here with an A low is an adult person with Down syndrome, who has a lot of independent skills but still needs some support. He has a basic plus waiver, a job coach, and qualifies for some other personal care supports. Um, in the reason I bring this up is because again, a lot of or not DDA, state legislators are being told sort of by DDA that they're cutting the lowest support needs first. They're cutting people who don't need as much help first. And my argument back is, hold up. In order to get DDA supports, you have to have an extensive history of a significant disability where your needs cannot be met in any other way. So whether or not you have low supports, that's misleading, because you already, in order to get the services, have proven that you need support. Also, what does low supports mean? Like, what does that comparison mean? Like I said, this gentleman has Down syndrome and needs supports. A lot of people, when they go in and look at their own classification group, have been surprised that they're as low as they are. We've met a lot of folks who have loved ones in the B category, where they would have assumed, oh, my kid must be in the E. They need a lot of help. And so it's important for you to kind of realize that and convey to your legislators, like, my loved one or myself is being considered as these lower support needs. That is a misrepresentation of my person. Here are the supports that this person really needs to be healthy and safe and part of their community. Don't be misled by this statement that the people being cut are people with low support needs. That's not accurate. Okay. And then also realize, like, at this point, cuts are happening across every support level anyway. And so low, high, medium, A, B, C, that doesn't really seem to matter in the long run anyway. But DDA is still sort of conveying that they've started with the folks who have the lowest level of need. So we've been working to try to change that narrative so that legislators understand what that actually means.
Well, it sounds like the last domino, some of the talking points was on the DDA. Sometimes you need to actually qualify to DDA to have other services open up to you. Even though they don't necessarily on DDA's menu, you need them. Like, for instance, the county has some Section 8 housing vouchers that they have sort of set aside that are only eligible for people who are eligible for DDA. So there's some supports that are tied to DDA. So there's this chance of, if you've lost your DDA eligibility, would you lose some other supports too? And another times they don't actually have to be eligible for DDA, but the fact that they have a case manager, and that case manager is able to work with them and explain other supports that are available, they get connected then to food support, other types of supports in the community. So there's a real concern that if you lost your DDA supports, you might lose some of these other supports as well. And the DDA actually charted that this year, and they found that when people who, compared to the people on the no paid services list to the people who had caseload managers, the people at caseload manager were well connected to all the other support. So there's concern that if you cut them loose, would they even know how to get help in other places, and what other supports might they lose? And also just this kind of coupling onto what Robin said, is that even someone who's pretty stable in a certain environment could just be one event away from a crisis. There was a very powerful story shared in one of the various legislative sessions I was sitting in on, of somebody, this is actually came from I think it was a DDA case manager. You know, they had somebody, and this is a person who actually was on a no paid services list. They lived with a parent. They were an adult. They're all adults, but they lived with their parent. And they were pretty stable. You know, they needed help, but the parent was able to support them. Well, the parent got sick. And I can't remember if the parent was hospitalized or if the parent passed away, but the parent was no longer in the picture. And suddenly this was a person with a significant developmental disability who only needed maybe the one support person, but now had nothing. And they lived alone, abandoned. I mean, it was a very, very, very sad story. But this was somebody in one situation was very stable, but as soon as you took that support away from them, they spiraled into a very, very tragic scenario. So, you know, that's something else, right? And this marries on to what Robin was saying, is that these are, I wish I had written down exactly how you said, Robin, when you said, hold on, but it's like, just to qualify for DDA, you have to have demonstrated significant need for that support. So, you know, not all disability is equal. There's some disabilities that are a little bit more intense than others. And if you're on DDA and you qualify for a waiver, you're like, you know, 0.2% of the population who've been lucky enough to qualify for a waiver, or unlucky enough to qualify for that. We don't know, we'll get it. But this is not something that just somebody gets because I like it. This is something that is pretty difficult to get, and we don't fund them for very many people. And then also, not that I want to make everyone think that, oh my gosh, it's constantly going to go into homelessness. But one of the reasons why I think where Robin and I get our passion is because we sort of see the long-term spectrum from early diagnosis into elder care. And we see that when the system is working, you know, great things happen. I mean, it's really wonderful to see when the system is working. But when the system doesn't work, you know, we see people who they're on their own, and it's rough. And we see people who are looking at homelessness or who are in homelessness. This is something we tell people all the time. The number one thing individuals with disabilities contact us about is housing instability and homelessness. So this is a real concern. And a lot of times people are a lot of legislators are really concerned about ending chronic homelessness, and which is great. But, you know, a key part of ending chronic homelessness are the things like supportive housing, supportive employment. They actually created a new waiver that kind of does what DDA services does, but for a different population, one that has less intensive disabilities population. So that's called the transformation waiver. But that was really kind of modeled on the DDA waiver. So if you're concerned, if you're a legislator, if you're concerned about the homelessness around you, why would you pull these supports for DD? Because those are the exact kind of supports that keep individuals and families stable and housed. So you're really looking at creating a big problem in another system if you cut these supports here. And that's all I have.
Ramona, do you want to talk just briefly about what this advocacy newsletter is and why people might sign up for it?
Yeah, so the advocacy newsletter, there's two that I send out. One is called Sharing, and that's a little bit more like supportive for it comes from our King County Parent Family Coalition. And it's really more like support. Like sometimes there's specific news from DDA around families. It really is geared towards families who are also caregiving or have a big role in helping keep supports for their loved one across the ages. So they're sharing, and that's more about support. And then they engage, which is really more specifically about advocacy. And what we do there is, it's like news, like there's what's going on in Washington, D.C., what's going on in the state. This is what's going on with the budget. So it really tries to give you some education around some of these different issues. If they are, we don't actually do action alerts really hardly ever out of the ARC of King County. We're just not funded to do that. But we will share other people's actions alerts. So we'll tell you what the news is. We'll let you know the ARC of the United States has an action alert on this. The ARC of Washington has an action alert. Here's where you can connect to that if that's something you want to do. But so yeah, so those are the two newsletters. We also have one for community change champions, and that's really geared specifically for people with disabilities themselves. And it's usually when we come across opportunities that are specifically for people with disabilities. And so we have another newsletter that's geared to that smaller subgroup of advocates. And then we have the King County Parent Family Coalition that works on different advocacy and connecting and civic engagement. And we have Community Change Champions, which is a support program for people with disabilities. It's led by people with disabilities. Eric Mathis, some people might know, he leads that program for us. And then again, we're all here tonight talking about advocacy, but the ARC has a lot of support to offer people. And so I also have just the regular link to the ARC of King County. We've got online resources. We also have people who can provide navigation and consultation services, directly on phone or Zoom. Someday, again, hopefully in person. But there's a lot of resources there if you go to the website. And again, I added Robin's contact information and my contact information.
So I'm assuming most of the information on advocacy and all is statewide for those of us who live elsewhere?
Yeah, a lot of it is. I mean, we're King County, so I will also have some King County specific news in there. Like I want to say the last one that went out was actually about King County's budget. So sometimes there's King County stuff in there, but a lot of it, especially when we get into the state legislative session, it's going to be statewide. Yeah, I'll probably be referring more the local politicians just because we're King County. Okay. But the news itself will be state and would be applicable.
And is it different than what you would get from the state ARC then?
I don't know that they send out weekly.
They send out a lot, it seems like.
I tend to see from the state ARC, they send out like action alerts, but I don't think they send out the the types of things Ramona sends out tend to be summaries of situations, summaries of like kind of policy, bills on the table, or summaries of what effects, a budget might have. I don't see that come from the ARC of Washington. They actually tend to lean on Ramona.
Oh, really? Okay.
For it. But I'll also add, if you live in a different county, since we are King County, Ramona is part of the statewide parent coalition. So across the state, there are other parent groups who are really engaged in advocacy efforts for DD issues. And Ramona could help sort of who from your area is involved in this type of advocacy work. So you can get more details about your own, your own county.
Yeah, and I'm in touch with the local. I'm on the board of the piece here.
Oh, great.
Darla
Yeah,
Health.
awesome.
Oh, good.
Yeah.
Darla's awesome.
Yeah, she knows a lot. She doesn't always get it out, it's mostly in her head.
Yeah.
It's hard to turn it from in there to out.
Yeah. Sometimes it doesn't always get to.
Yeah.
Yeah.
Great. Well, thank you both so much. This was incredibly informative. I have learned so much and will be sending out some emails, some letters for sure. So just so everybody knows, this is all recorded, so we'll have it up online. So if you want to rewatch parts of it or share with friends or family members, you can do that, and I'll make sure I send that out in the follow-up email where you can find that. And then as Ramona said, all of the links in the PowerPoint, I'll pull them out so they're a lot easier to find, but I'll include the PowerPoint as well for some of those graphics, as well as all the contact information. So unless anyone has other questions, thank you so much. Feel free to send questions, comments after the fact as well.
Yeah, feel free to reach out to us anytime. Even if you're not in King County, we can answer some questions or help direct you to somebody who knows more in your kind of area. So feel free.
Thank you.
Thank you, everyone, for joining us tonight.
Great.
Take care.
Bye.
Thanks so much. Have a great night, everybody.
Bye, dear.